Most people think pain begins where it hurts. Your knee hurts, so the knee becomes the focus. Your shoulder hurts, so everything centers around the shoulder. Or your back hurts, so attention stays entirely on the low back. And sometimes that's true, but one of the first major shifts people make when they begin understanding the body better is realizing that pain is often downstream. Your knee pain may not actually be coming from the knee itself. It may be coming from the hip, or the ankle, or the way force is moving through the body as a whole. And for many people, that realization already feels like a revelation, but there's an even deeper layer that often gets missed, because then we have to ask, why did the hip stop functioning well in the first place? Why did the body begin redistributing force this way? And that's the layer I'm interested in. Because bodies develop patterns long before pain appears. Some people spend years sitting rigidly at a desk. Some people stop loading their bodies normally and slowly lose stability without realizing it. Some people live in constant motion and never fully recover. And some people unconsciously protect one side of the body for years after an injury that technically healed a long time ago. At first, the body adapts. That's what bodies do. They compensate. They redistribute force. They create workarounds, but they keep functioning until eventually one area starts carrying more stress than it can tolerate. And that's when pain finally appears. So when someone develops knee pain, there are often multiple layers involved. There's the painful knee itself. There's the biomechanical system underneath the knee. And then there's the long-term adaptation pattern that shaped the biomechanical system in the first place. And it's that third layer where things become really interesting. Because over time, behavior becomes structured. The way we move, recover, work, exercise, sit, adapt to stress, avoid stress, compensate or overload ourselves slowly changes how the body organizes force across decades. And eventually those adaptations become visible physically. So this channel is about learning how to see those layers more clearly, not just where pain appears, not just the mechanics underneath it, but the deeper patterns that slowly shape the body over time. Because chronic pain is often not a random event. It's a structure that took years to build.